According to new statistics from the Centers for Disease Control, the U.S. now ranks 29th in the world in infant mortality. That's tied with Poland and Slovakia. Last year, the U.S. ranked 27th, and in 1960, it was 12th. Why the drop? Well, some organizations say the answer may lie in the recent rise in premature births. Joining us now via satellite from New York to talk about this troubling trend is Dr. Jennifer House, president of the March of Dimes. Dr. House, welcome.
Thank you very much.
Dr. House, the March of Dimes has been focusing on the rising rates of premature births recently. Why?
Well, we certainly think that the troubling trend in the rise of infant mortality is tied to the rising rate of preterm birth. The March of Dimes has engaged in a national campaign to prevent prematurity because we believe that this is the #1 obstetrics problem in the U.S. We know that it's the major contributor to newborn death, and we also know that the rates of preterm birth have been rising over the last 2 decades.
Why are they rising? Do we know why they're rising?
Well, the rise in the rate of preterm birth is really falls into 2 categories. The first category is called we don't know, and that's why it's so important that there be additional investments in research so that we can come to understand the answer to the question, why do women go into labor too early? The second category has to do with risks primarily. We can identify quite a number of risks that would result in preterm birth, and the important thing is to be able to identify those risks and then be able to address the risks before pregnancy or very early in a pregnancy.
You kind of touched on this briefly. We do know that the financial cost is high in dealing with premature births and studying premature births. More than $26 billion annually is being spent. But what about the human cost as well?
Well, the Institute of Medicine published a study a year and a half ago showing that $26 billion was the annual cost for preterm birth. The human costs are really tragic and very severe. The human cost of parents anguishing in neonatal intensive care, not knowing if their baby will live or die. The human cost for those babies who do survive and who do have lifelong problems, and the need for parents and families in the community to support the special needs of those children.
Do we know why more babies are born prematurely in the United States compared to some other countries?
Well, I think there are a number of reasons. First of all, we don't have very good access to health care services for pregnant women and children. We have 11 million women in this country of childbearing age who do not have any health insurance, and 9 million children who don't have insurance coverage. So that's one reason. Secondly, there are risks involved in pregnancy: diabetes, hypertension, obesity. These risks have to be identified before pregnancy or early in a pregnancy so that they can be addressed. So that if women don't have access to health care, these risks are not going to be identified early enough to make a difference.
Dr. House, real quick, I want to interrupt you. You keep mentioning that access to health care. How are these women going to get health care? Where can they get health care? How can we address this problem if the health care isn't available to these women?
Well, I think the important thing is for federal and state officials to continue to work to expand insurance coverage, either private insurance coverage through employers or public health insurance coverage. The way women will get insurance will vary from state to state, but the point is that it's a risk factor for women to not have health insurance when they are thinking about getting pregnant.
There are many nations with very low infant mortality rates, such as the Nordic countries, Japan, Hong Kong, and Singapore. What are these countries doing that improves infant survival? Why aren't we doing the same thing?
Well, I think there are a lot of differences between the United States and these countries. For one, we have a much higher number of African Americans in our population, and the risk of preterm birth is about twice that for all other communities. So that's one difference. Secondly, I think there are probably some differences in the risk factors between the populations in these countries. So I think direct comparisons are difficult, but the important thing is that the United States really needs to focus on this epidemic of preterm birth.
Well, that brings me to the next question. What about research funding, education, outreach programs? What are we doing? These are tough financial times. Does that affect the funding right now?
Well, these are very difficult financial times for us as a nation, but I think it's also a time for us to get our priorities straight. What could be more important than the health of the next generation? So the March of Dimes and others plan to advocate for increased federal funding for preterm birth and other childhood disease problems.
Might it also save money in the long run if we did invest this money now to prevent the premature deaths in the future?
Well, the key to this epidemic of preterm birth is to understand the reasons and then to be able to prevent preterm birth from occurring in the first place. And with prevention, we're going to save money.
Doctor, you mentioned the African American community. What's being done specifically in that community? That it seems to be a community that is very high at risk. Is there any outreach specifically targeted at that community?
Well, I think the March of Dimes and many other organizations are particularly concerned and doing community outreach programs. We're working in partnership with the Office of Minority Health to do education programs. The highest risk for a woman for having a baby born premature is if she's previously had a preterm birth or if the women in her family are disposed towards prematurity. So it's really very important for women, regardless of what community they come from, to identify this risk early to their doctors.
Do we know the real cost of premature deliveries?
Well, what we do know is that a premature delivery costs 15 times as much as a normal delivery. And that's a very, very serious financial problem for the U.S. And you know that the annual cost to our country is $26 billion for all of the costs associated with preterm birth.
Can we talk about C-sections? Are more women getting C-sections to avoid any complications in premature deaths? Is that playing a part in this in any way?
I think there's a connection between the rising rate of C-sections in our country and the rising rate of preterm birth. In the United States, 31% of women deliver through C-section. That's much higher than other industrialized countries. And I think that we really need to work in this country to have a review of C-section practices in hospitals and to make sure that we have C-sections only at the right time for the right reasons.
When you think health, think IRU.